sometimes what you will see, either you see blood in the toilet bowl, you can see blood on the toilet paper when you wipe, and often when anybody sees blood in their motion, that often sends them running to the doctor. What this can be the causes of blood, it can be anything from bowels or hemorrhoids, we call it. It can be from a tear in the anus called anal fissure, where it's very painful when you pass motion. Or sometimes, and of course, what we don't want to know is that whether is this a sign of colorectal cancer. And particularly if you have blood in the motion, it usually means that the tumor is actually very close to your back passage or your anus. So, but blood during motion is definitely one thing that requires people to see a doctor. Now, the other thing that some people are less aware of is that what happens if your bowel habits have changed, and you used to go toilet maybe twice a day, and then you pass very nice stools, and then now what happens is that now you're going to toilet maybe 6-7 times a day. It's all watery stools that's coming out, and then people just think that, oh, maybe I ate something wrong. What happens is that we're not talking about that 3-4 days, 1 week, where your bowel habits have changed. What we're talking about is that 1-2 months, 6 months that you notice that it's totally different, it's not the same anymore. Sometimes it comes so urgently that you cannot even control. And that's the one that's worrying. Okay, then the third thing, of course, is tummy pain. Usually this will be a sign of very late cancer. So what happens is you have a tummy pain, usually at the same location, every day, all the time, you're having this pain. And over the few months, it tends to get worse. And of course, it's certainly possible that your tummy pain is associated with other symptoms like, blood in stools, or your bowel habits have changed. So again, this is a worrying sign. Now, before I get on, as I mentioned earlier, there were 2 more signs and symptoms. One of them, of course, is if you are losing weight. And this is what we're talking about, loss of weight that is not explained by dieting, not explained by any increased exercise. And again, just like stomach pain, that tends to be a fairly late sign of any cancer for that matter, not just colorectal cancer. Just to talk a little bit about family history. As I mentioned earlier, family history is not a sign, it's not a symptom, but it's something you should be aware of. So if, for example, any one of us sitting in the audience, we have perhaps one of our parents who has colorectal cancer, then it's important that you should go for a colon check 10 years before your age of diagnosis of your parent. So like today in my clinic, I actually had a colorectal cancer patient. He was diagnosed many years ago, but at the age when he was diagnosed, he was 38 years old. So when his children came along with him to see me, I actually advise the children today that they should be going for colonoscopy at age 27. And that's because their father had colorectal cancer at age 38. So 38 minus 10, you should be going somewhere around 27 years old, 28 years old, thereabouts. And that's something we should be aware of. And similarly, if you have a lot of relatives, or even again like your parents, and they didn't have cancer, but they have like very large colon polyps, or they always have to go for scopes because their colon constantly is developing a lot of polyps, then again, that's something that should make you want to do an earlier scope.
Terima kasih telah menyaksikan video ini, dan jangan lewatkan video menarik lainnya dari channel Tkon TV. Sampai jumpa di video selanjutnya. Stay healthy with Tkon TV.